So thank you for inviting me here today. It's always a pleasure to talk at this event. These are my disclosures. None are financially relevant. So we've all heard about this controversy of milk and acne and what's really involved. And what we'd like to do is, obviously there have been some epidemiological studies linking skim milk to acne. And I'll go into a little bit more details about why skim milk might be interesting. But what we wanted to do is really understand how is the different components of milk, how are they affecting the sebaceous glands, and how could that be contributing to the inflammatory effects that we see with acne. So just to think about acne and milk, acne clearly has a widely prevalent, profound psychological impact, and we'd like to learn about all the possible triggers that are out there. The thing about milk is that, especially with skim milk, now I don't know what the rules are in Oregon, but in California, when you make skim milk, you have to pull out the fat and you have to put in a filler. And the filler can be full of whey, and it can be full of high glycemic index products and also oligosaccharides. And it turns out that that might be one of the contributing factors for why we're seeing the epidemiological associations with skim milk rather than, say, whole milk. And so what we want to do is really think about what are the mechanisms that are involved. There have been a few theories that have been put forth. They're not quite well identified and well known, but one of the pathways that are thought to be involved is the mTOR pathway. The mTOR pathway has been hypothesized in actually multiple nutritional ideas, such as meat intake, milk intake, high glycemic load, and Dr. Thibodeau has done some work even showing that if you have insulin stimulating the PI3K AKT pathway, that has been associated with higher lipid production in the Sebocytes. So along those lines, I wanted to give you a little background on milk components. And so milk is mostly composed of water, but within the micronutrient component of milk, there's quite a large component that's just proteins. And here I'm showing you human milk oligosaccharides. We work at the Foods for Health Institute. They break apart human and bovine milk, and they're able to get all the subcomponents. What they do is they defat the milk. And so what you're left with is pretty much the oligosaccharides, and then there's also the whey permeate. And then what they do is they do an organic extraction and take the aqueous solution. That really works out well for us since aqueous things dissolve in media very well. But when they take the aqueous component, then what you have is you've selected for the oligosaccharides. It is a mix of multiple different oligosaccharides. One of the controversies with oligosaccharides, when you think about what are they, first of all, there are many different origins, including plants and animal origins. And they're typically these short chain saccharides, like 2 to 3 to 4 sugar molecules that are linked together that are largely indigestible, and so they can absorb. In fact, they've shown that when people drink bovine milk, they've shown that, and they've done studies in women, that you can see the bovine milk tags go into the bloodstream and even getting expressed within their own milk. So that's kind of an interesting side conversation there. But they're typically non-digestible, and they're believed to have prebiotic properties. And one of our questions with oligosaccharides is that they've largely been shown to reduce inflammation in the gut, especially human milk oligosaccharides, and they're supposed to promote colonization of helpful bacteria. However, on the other hand, they also have been shown to activate the PI3K AKT pathway. So there is this dichotomy of could it be helpful or not? And this is one of the reasons why we wanted to focus on oligosaccharides. And so our hypothesis is that bovine milk oligosaccharides will activate proliferation and lipid synthesis in Sebocytes. And so to do this, we did get the purified oligosaccharides. They're obtained from our partners from the Foods for Health Institute. And it's a water-soluble fraction, as I'd mentioned, so that worked out well in terms of at least being able to test them before we started digging deeper into which oligosaccharide might be contributing to whatever we find. And then the Sebocytes were generously, we have a partnership with Dr. Thibodeau, who's done a material transfer to give us her cell line. And so all the data I'm showing here is from the cell line. So to start with, what we found was we treated with oligosaccharides at the level of what has been previously reported in people that ingest milk. And so what we found was when we looked at proliferation, we found a dose response increase. You can see here the controls, and then working your way to the right, this is MTS assay, there's more proliferation. And then we also wanted to assess for cell death either by apoptosis or necrosis, and we saw neither. The levels that we were using weren't killing the cells. The next step we wanted to look at was, does it increase lipid synthesis? Does it actually increase the lipid content? And so what we have here is a Nile red assay, and what we do here is we take cells before they're exposed to the treatment, in this case the bovine milk oligosaccharides, and then we can look at the neutral lipid density within the cell before and after, and then we normalize to the DAPI counts so that we can normalize. So it's basically a lipid per cell basis, and then we normalize to the control. And here you can see it's about a 7% increase, give or take, when you look at the Nile red signal. And then we also followed up with SREBP1 expression assessment. SREBP1 is a transcription factor that's involved in a lot of lipid synthesis enzymes, and we found that that increased as well. So one of the questions that I've been very interested in is not just looking at total lipids, but starting to understand lipid profiles and look at which of the different lipid mediators may be involved. And so we looked at inflammatory mediators, including cytokine IL-6, which had a 20-fold increase when exposed to the bovine milk oligosaccharides. But we also looked at COX-2, cyclooxygenase 2, which is important in prostaglandin synthesis, and also 5-LOX, which is important in leukotriene synthesis. And so we found in all three of these cases that there were elevations in the enzymes for COX-2 and 5-LOX, and also IL-6. Now what we're doing is we're actually breaking down all the lipids to look at whether what like leukotrienes are being produced and which prostaglandins. I don't have that data yet, but this is the precursor to that. And so I wanted to talk a little bit about the mTOR pathway. Since I alluded to that in the very beginning, there's a lot of conversation about the mTOR pathway and then how that might tie into whether we make more lipids or not. Turns out the mTOR pathway is largely formed by these two major complexes, mTORC1 and mTORC2. A lot of the studies have focused on mTORC1. mTORC1 is thought to be involved in lipid synthesis. If you follow the diagram down, you'll see that mTORC1 leads to SK6. It typically phosphorylates SK6, which can then cascade down and phosphorylate SREBP1, SED1, and then lead to lipid synthesis. What we don't know is the role of mTORC2. mTORC2, we have no idea what that does in Sebocytes, and a lot of studies haven't focused on mTORC2. What we did was we used 3 inhibitors. You can see here on the edges, KU, RAPA, and BEZ. RAPA is rapamycin, well known. It's used widely in transplant patients and known as sirolimus. KU and BEZ are largely experimental, but they're both inhibitors of the mTOR pathway. So what we wanted to know is, do the mTOR inhibitors abrogate the effects that we saw with the bovine milk oligosaccharides? So walking from left to right here, just with proliferation, what we saw was the bovine milk oligosaccharides, as I had shown before, do increase proliferation, and all of the different inhibitors reduce that proliferation back towards baseline, and in some cases, such as KU, a little bit, they even did extra inhibition. Now, one of the questions that we had was, could this just be an artifact? Because we know mTOR inhibitors in general can inhibit proliferation. Could this just be a competition where bovine milk oligosaccharides are doing one thing, and we're just happening to put down an mTOR inhibitor that could then be blocking proliferation, regardless of whatever pathway bovine milk oligosaccharides are taking. So to address this, what we did was we looked at SK6 phosphorylation specifically. And SK6 is phosphorylated when the mTORC1 complex is active. And so what we found was when we exposed these cells to the BMOs, SK6 phosphorylation did indeed go up, suggesting that mTORC1 pathway was more active. And then we were able to block that activation by using each of the mTOR inhibitors. And so overall, what I'm showing here is that the oligosaccharides do activate proliferation and lipid synthesis. They may be pro-inflammatory, even though oligosaccharides have been shown to be anti-inflammatory in a large set of cases, especially human oligosaccharides in the gut and in other areas, and they are a prebiotic. I think the point here is that we have to be careful that many of these oligosaccharides may have different effects than what we think, and we're finding them to be pro-inflammatory in the Sebocytes, and it appears that the oligosaccharides do act through the mTOR pathway. And so what we're doing now, as I'd mentioned, is we're going to be working on lipid profiling of the eicosanoids, both the leukotrienes and prostaglandins, and we are comparing to the other subcomponents such as whey on the peptides and the lipids. And with that, I would like to acknowledge the AARS and Dr. Wakas Burney. He's going to be the one presenting the poster. He couldn't make it today, but he's a postdoc working with me. He did quite a large amount of the work here. I want to thank Dr. Isroff, and Dr. Burrell is the one who supplied us with the oligosaccharides, and I'm indebted to our funding sources, the Almond Board, the USDA, and then we do have an SBIR grant with the NIH. Thank you very much.
Bob.
Hi, thanks. Good talk. I was wondering, since you had mentioned you want to separate the differences between TORC2 and TORC1, and you obviously got all your inhibitors got down to TORC1.
Yeah.
Have you considered affecting the TORC2 complex, either knocking down Richter or MSIN1? Because that way you still leave the TORC1 pathway in effect by PDK1 and phosphorylation of AKT. That way you could actually get to see if there is a TORC2 component specifically.
No, this is an excellent question. In fact, I'm not showing the data here. What we've done is none of the inhibitors selectively block TORC2.
Yeah.
So what we've done is siRNA knockouts of TORC1 and TORC2. And you can show through AKT phosphorylation whether TORC2 is active or not. What we found is with TORC2, it turns out, and this is interesting, when we inhibit them selectively, actually the prostaglandins and leukotrienes go up. And so I think even clinically, when you put people on rapamycin, they can flare with acne. So lo and behold, just blocking mTOR pathway isn't enough. But is your question in relation to lipid synthesis?
I was just curious about your design. That's why you had mentioned about how you want to separate the two different
Oh,
pathways.
yeah, in this case, it was more looking at the TORC1 pathway, but you're right. We have done siRNA knockouts to show that they're involved as well. Yeah.
And just one quick question. With regard to the whole milk versus skim milk and the oligosaccharides.
Yeah.
What again is the difference, or is there a difference between the two?
No, that's a good question. Between whole milk and skim milk, oligosaccharides are pretty sparse in milk. You have to actually go and drink a lot of milk to get the oligosaccharides. I don't think anyone's tested the difference between skim and whole. But what we do know is they take whey permeate and put that back in as a filler, which contains oligosaccharides.
Okay, that's the difference.
So
then.
that could be the difference, right?
Okay. Great, thank you.
Thank you.